There are three ways in which AI is going to change your job forever.
Hi guys, I guess I'm live now. Am I audible? Am I visible to all of you? Kindly comment in the comment box. Am I audible? And are you able to see me? Yeah, the first one, Dr. Ankur from the ICU channel. Yeah, hi Dr. Chirag, welcome. Nice to see. Audible and visible. Thank you so much for that feedback. Dr. Setu, yeah, hi sir, audible and visible. I guess Dr. Setu from Chennai, now in Malaysia, if I'm not wrong, right? Dr. Setu, you had a word around a day back. SB Sheikh, yes. Dr. Ajit, yes. Dr. Rohit, yes. Okay, thank you so much. So, Dr. Manvi is also here. Yes, sir. Okay. Dr. Tang is also here, and I had a word with Dr. Tang yesterday itself, and in fact, today also, and he's from Hong Kong. Yeah, Dr. Denny. Yeah, Dr. Denny Tang. Yeah. So, yeah, hi, Doctor. Hi, Dr. Abdi. Yeah. So, welcome to this live session for MRCP Part 1 preparation. And to be very precise, what I will be discussing in this 1 hour is for the ones who are going for this exam on 9th of August, right? So, just 2 days from now on. So, first of all, can I know who all are going with this exam? Can I know in the comment section? The ones who are attending this live, who all are going with this exam on 9th of August. Okay, Dr. Sethu, yeah, I'm taking. Okay. What about others? So you all are preparing for the next one, yes, for the October. Oh, yeah, Dr. Monica also says yes. Okay, great. Okay, Dr. Abhash also. Okay, yeah, Dr. Abhash, if I'm not wrong, you texted me around a month or 2 months back, right? And you joined the past test course by myself, by Dr. Chirag. So is it, Dr. Abhash, the same, if I'm not wrong? Okay, okay, yes, yeah, 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 yeah. So, and yes, you are going with this exam, yeah. So, I have seen many hi and many yes for the particular question which I just asked. So, thank you so much for joining this session. And this is, as I just mentioned, this is mainly for the ones who are going with this exam. And also, I'll be talking for the ones who are preparing for the next exam, which is the October exam, right? So, how to approach this exam, how to go about it, what is being asked, and obviously all the things related to this particular exam, MRCP Part 1. So, fastest MRCP essential are superb, sir. Thank you, Dr. Tang, for that. Thank you so much. Okay, thank you so much. So now the thing is, first of all, I need to discuss the agenda of our live session. The first and foremost thing I would like to say is for the ones, as I mentioned, who are going with this exam and how to crack this exam, right? Medicine is very, very vast. We all know that. Now, how to particularly go about reading the things or the topics which are actually important for us for cracking the exam and also to score high in the examination. That is what question I keep on getting each and every day on my mail, on my DM, on my WhatsApp. So each and every day, right? So I thought, why not to go ahead with this live session to clarify all the doubts regarding this preparation and just 2 days before the actual exam. So, legendary person, thank you so much for all the good words. Thank you so much. So, whatever query you have, right? So, just type in those queries, whether you are going with this 9th August exam or maybe later on, right? I'll try my level best so as to see those comments because this is just my first or second live, right? So, I don't know how to actually scroll this. So, I'm also adapting to this new technology, right? To YouTube live, and also I'll be going ahead with the Instagram live as well. Now, so the first question and the first agenda of this particular meet is how to crack this exam, right? And when you have only 2 days left. So you might have done your preparation for 2 months, for 3 months, for 5 months, for 6 months. So I can't say, but yes, you might have done the preparation if you are going with this exam, right? Now, point comes is how to revise. And this is what I keep on getting question each and every day. Again, sir, it is very vast. We have done all the units from either the past medicine or the past test or on the exam and many other things which is available on online, right? So as to go efficiently with the revision, my suggestion is always in the next 2 days go with a retrospective study. Why the word retrospective? What I mean is you have to go with the previous year papers or the sample papers given in on the MRCP website, right? So if anyone don't know it, yes, there are 197 questions which are given on the MRCP website as a sample question. You just need to log in mrcpuk.org, go to the part 1 examination, click on that, and you will be able to see the sample questions. So they are 197 in questions over there. So just go with those as well as the recently asked questions in the examination, let's say April examination. So with the retrospective word, I need to say is you see a particular question, right? Let's say it is of atrial fibrillation or HOCM. So you don't need to just skip the question on the basis that yes, you know the answer to that particular question which they have asked. Let's say they have asked what is the first line management of atrial fibrillation. You know that, right? You know that. Now the thing is you need to know whole topic. It's not just one question and answer to that particular question. You need to know about atrial fibrillation. What are the risk factor? How is it classified? How it presents in in patients? Also the other management options. If not blockers, what next? If you have done the rate control, what next? How do you go with anticoagulation in these patients? And these patients are at a risk of developing stroke, right? So which is the score used for that? So as to prevent, and if at all the score is on a higher side, what is the management for those kind of patients? How do you prevent stroke in AF? So in totality, it is the atrial fibrillation or maybe any other. Let's say the question is on IBD, inflammatory bowel disease. So you need to know everything about the ulcerative colitis and also the Crohn's disease, right? So please, whatever being asked in the examination, I'll not say revise everything because it's not possible in the last 2 days. Yes, for the ones who are going with the October exam or planning for the January, yes, they can, but in the next 2 days you will not be able to. It is impractical to say that yes, revise everything, right? It is very easy to say rather than being done, right? So to be very practical is see the question which they have asked in the previous examination and then revise and recollect in your memory. If you're not able to recollect all the points, let's say of ulcerative colitis, you're not able to remember or recollect the management option, then just go ahead with the theory from wherever you have read. I'll not name, I can't say which theory book or question bank you actually followed. So my advice is just go back to that and see the explanation to that particular topic, not just the question. So this is what is called as retrospective study, and I keep on suggesting and giving this advice to many, and many have actually implemented and successfully cleared this part 1 examination, right? So this is how to crack this exam. Now the other agenda and the other question, other query which I keep on getting in my on my WhatsApp or my mail is how to score good in examination, right? So if you are able to reach that 60%, which they actually say as 540 marks out of 999, it's not 1000, right? So it's not like each and every question carries 5 marks. No, there is a equating system to it, right? So the thing is, wait a minute, I got a question. How many years of past papers to be done? Okay, I'll tell November 2022 recall and April 2000 must read. Okay, so April 2023, Dr. Tang, yeah. So yes, that is must read, and yes, I have a book available, a recall book. Although I'm not promoting anything on this live, but yes, I have. Yeah, good day, greetings. Yeah, you too, Dr. Rishi. So you can go ahead with those. Although I have tried my level best, and all the students who were there with me while making that ebook for all of you, the November recall and for the April recall. So they have put in their effort as well, and I edited that and included majority of the text required for that particular question. So it's not just the question and the answer; it is a well described explanation which is required for the examination, or which you need to know before going to the exam, right? So that was something different. So I'll come on to that again. Regarding the question by Dr. Monica, how many years of past papers? Yes, so this is another question which I keep on getting is how many years. So in past papers, in past test, you have many. So they start from 2016 till to 2023. So it's a huge one. So what I suggest is just go with the previous 2 or 3 years. That comes out to be around 10 papers, not 10 years, right? So 10 papers are sufficient enough to know the topic which they are asking in the examination. So what is the benefit of past year papers or the previous year papers is not that they are going to replicate and they are going to actually take all those questions and ask in your examination. No, the topic remains same. They keep on asking, they keep on molding the question, the stem of the question, or the options in the particular question. So you need to be good in the particular topic, not the particular question. So please, my advice is do not ratify, do not mug up. सिर्फ रट्टा नहीं लगाना, राइट? कि सिर्फ आपने 10 years जैसे we used to have in our प्री यूजी डेज, राइट? कि 10 years है, 10 years आपने रट्टा लगा लिया, और इन सम पीजी डेज कि आपने 10 years रट्टा लगा लिया, yes you are through with the exam. No, not done. You have to be good in a particular topic being asked in the previous examination. So my suggestion would be just stick to 10 papers, 10 previous papers, and that's it, and keep on doing in a retrospective manner, right? Dr. Matin Khan, can you please tell me where can I get your past paper recall book? Is it online? If yes, then please share the link. Okay, I don't have the link right now. So I have my application on Play Store. You can write as Intellect Medicos. You can see over there. And for the ones who are using Apple or the iOS users, you can install My Institute, right? So My Institute, I'll just write over here. Wait a minute. So Intellect Medicos is the app for. Are you able to see my messages? Are you able to see my messages? I just wrote in Intellect Medicos. Yeah, yeah. Okay. But we have. I have. Dr. Monica says I see 100 questions of each sitting. Yes, I'll talk about that also. Yes. Yeah. So Intellect Medicos is on the Play Store, and for the iOS users, you have to install My Institute app, right? And then it'll ask about the ORG code, which is TAUBG. So this is what you need to enter, and you will see my ebooks over here for the November as well as for the April. And if at all you are having any sort of problem, you can contact me on my mail ID. I'll just share my mail ID: intellect.medicos1@gmail.com. Right? If at all you're finding any problem, or you feel you're not able to go through, you're not able to actually get that book or any other issue, so you can reach out to me on this intellect.medicos1. Yeah. Talking about, so I have left my question, so I'll be answering the question by Dr. Monica. I see 100 questions of each sittings, but we have 200 questions in the real examination. Very rightly said, right? So we have two papers in a single day, in the morning and in the afternoon. So 100 each, right? 100 questions for 3 hours, then 100 questions for 3 hours. You all know who are going with the exam. Obviously, you will be knowing that. Now the thing is. with the kind of recall we have. So in the past test we have only 100 questions, very well taken, but the point is 100 are the missing ones. Okay? And this is what I have tried in my recall box in the November and in the April, that I have tried with 192 in the one in the April and 194 in the November exam. So this is how I have I'm not I my students who have actually contributed, and I have given credits to them on the very first page of the book, that they are able to recall these many questions, right? So obviously we have to see all of it, not just half of it, right? So but in the previous year papers, obviously you are not able to see 200, but still you are getting those hundreds, right? And those are good, those are pretty good. So don't just think about what are those 100, wo 100 रह गए वही 100 ना आ जाए, right? So don't think in that manner. Obviously that will increase your palpitation, your anxiety, so don't think in that manner. Just think, yes, we need to know the topic being asked, right? So the main purpose, I would again re-emphasize, is knowing the topic, not the question. Okay? Please know the topic which is being asked repeatedly in the examination, and also the questions in the sample papers, sample questions on the MRCP website, right? Okay. So is it mandatory to solve past tests? I'm opting for October diet. So the thing is, mandatory to solve past test. If you're talking about the unit wise, yes, it is a good one, right? And I'm not saying because now I'm a faculty at past test. Yes, I love past test from the very past, right? When I gave my exam in 2019, I myself did past test, right? So the thing is, yes, I like it, no doubt, not like, in fact I love past test, right? And that is why I am going ahead with releasing course, and I'll be happy to say also that I am going ahead with part 2 course on past test as well, right? So in a month or so you will get that notification, you will see that notification that I'm going ahead. Even past test will also upload on their site that I'll be taking a course for part 2 on their platform, on past test platform. So yes, past test has very good questions, no doubt, no second thought about it, right? Also, yes, if you are talk about the previous year papers, that is the only place where you can get a previous year papers till 2016, or if I'm not wrong, they are I guess giving 2015 also. I'm not sure about the recent times, but yes, start from 2016. So this is what you need actually. If you have much of time, I would say yes, you can go till 2019 or maybe 18, depending on the time. But for the ones who are going with this exam 2 days from now, so obviously I can't say, and it is not required also. It's not, I'm just trying to help you out with with the critical time, but yes, it is actually not much helpful. Okay, so if you have much time, you are able to take out time from your busy schedule, from your social life, then yes, you should. But the best out of it would be just 10 papers, and stick to those 100. See the topic which is being asked. Again, I'll re-emphasize on that word. I'll come back to my previous question, which I keep on getting, is how to score good in exam, right? So I have talked about how to crack this exam, how to revise efficiently in the last 2 critical days. Now, how to score actually goes, you can go ahead with the minor subjects, or the clinical sciences, or the biostat. So these are the topics, 5 units, I would say. One is your psychiatry, ophthalmology, dermatology, clinical sciences, and the biostats. Because these are the topics which are being left, or many of the candidates, they escape these units. They escape. They just keep on doing the question from cardiology, because many of us as medicos, as doctors, we love cardiology. As a person, I also love cardiology, right? So cardiology, you have interest in neurology, so yes, you would be better in neurology, or maybe gastro or nephro. But the thing is, uh, uh, can you repeat this section again? Which section, Dr. Ankur from the ISU channel? And he's very close friend of mine, and a very, very good doctor and a consultant, and even the head of critical care at Apollo Indore. And he has this channel, the ISU channel by ESBICM. which topics to read, which topics to okay, so five, right? So I am talking about for the ones who are going with this exam, and the question related to it is how to score good in the exam, right? For your marks to be there, having just crossing 540, you have to go ahead with all the units. But if you want to score very high, right, more than 650, then you should emphasize, or more than 600, I would say, you should emphasize on your ophthalmology, psychiatry, dermatology, clinical sciences, and fifth one is your, I'll just write it down, means left out topics. Yes, 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 yes. So these are the topics which actually majority of candidates they leave. And here comes the role of equating. So they equate the question, right? So if a question is attempted correctly by a candidate and which is very difficult, right, having a difficult level, and is being very less attempted or very less correctly answered by majority, then it carries high weightage or high marks in the actual exam. And this is what equating is. And that is why the the total marks in this MRCP exam remains 999. It's not 1000, right? So it's not like every question, all the 200 questions carries 5 marks coming out to be 1000. No, it's 999 actually, right? So you and you can't predict in the actual exam. So if you are going with that kind of and many people on Facebook, on Insta, on many other social media platform, they just write it down. If you are getting to 125 or 130 out of 200, you are through with exam. No, you can't predict that, right? Maybe if you are getting 125 in the correct in the actual exam, and although those questions are the average difficulty level, then yes, it is difficult to say. But if you have scored and you think you have scored more than 135 or more than 140 as the correct one, yes, it is a safer one, right? So don't just be on that questions. See how many questions you need to mark it correct in the actual exam, right? So just go ahead with the preparation. Don't think about the marking much, because only 2 days are left. So these are the topics. If you liked me to write it down, all the five which I just mentioned, do let me know in the comment section, right? I'll write it down. Now, the next thing, so this is what we have discussed, is how to revise, how to crack this exam, and also how to score good in the exam. The other question which I keep on getting in on my email or WhatsApp is what is required for the examination, right? So for that particular thing is one most important which you have to take along with you in the actual exam is the confidence, right? You have to have that confidence while moving inside, while going to the examination theater, right? You have to have that confidence, whether you are not, whether you are able to recollect everything, whether you are not able to recollect everything, whether you are not able to revise in the end, whether you were putting your effort for the past 6 months, you need to have that confidence. Or whether you have not slept, whether you have not get that cab in the morning, you are not able to reach your exam center at the what you have supposed to be. So these are the last minute things, and so don't decrease your confidence before entering into the examination hall. So the first and foremost which is required is the confidence level. Second thing I would say is the admit card. Obviously you have to carry the admit card, which you might have got in your on your mail IDs. Third is you need to have IDs, yeah, right? And IDs, what I suggest and what I recommend is to take at least 3 IDs, right? So do not just go with one of the ID, because I have seen myself in my part 1, part 2, as well as the feedback from the students in my batches, in the previous batches, that yes, many other candidates who get this problem at the examination center, that the invigilator, they do not allow you to enter because your face is not matching, or there's some discrepancy with a document. So always it is advisable to carry at least 2 or 3, right? So I carried 3, right? Or I carried my driving lessons, I carried my passport, and also my PAN card, right? And I had my election card and everything on my mobile also, right? So because I don't want that last time anxiety before the exam, right? So try to avoid that. Try to avoid that. Uh, okay, can you please write those five topics, sir? Okay, I'll just write it down. Ophthalmology, dermatology, psychiatry, clinical sciences, or the sciences, clinical sciences, or the basic sciences. And fifth is the biostats. Please do not worry about the calculation they'll be asking in biostats, right? So they'll not be complicating things. They are not testing your mathematics in a MRCP exam. They just give you the simple calculation. So please ratify, please have those formulas of sensitivity, specificity, negative predictive value, all those, right? All those in your mind, and keep on revising in the last day also. That is what is required. Clinical sciences table, wherever you have read it, go ahead with those tables, right? Clinical sciences, again, very important and carries high weightage. Ophthalmology, dermatology, psychiatry, there are very less questions already in your question bank which you might be following. So just go with those. Don't be in the greed to extract more, to finish two question banks or three question bank or four question bank. No, you don't have to be that greedy at this point of time, right? Yes, if you have 6 months or 1 year for yourself for exam preparation, yes, you need to have that greed so as to cover everything. But in the last 2 days, you need to be very selective and very focused. You can't be wasting your time, right? So this is any reference range and calculator will be given, no. So again, I mentioned this is not a mathematics exam, this is MRCP exam, right? So no calculator, and yes, reference range for all the investigation will be provided in the particular question itself. Let's say sodium, pH, PaO2, PaO2, and you need to know the values in the units which they usually ask, right? You can't be remembering about glucose level, let's say, as 60 milligram per deciliter, which we actually do in our country and majority of countries, because they go with millimoles per liter. So it is almost equivalent to 3.3 millimoles per liter, right? So you have to know, and you need to know the conversion factor also, right? So as if when you change, you have the formula as molecular weight divided by 10. So of glucose, it is 180 actually. 180 by 10 comes out to be 18. So you have to multiply millimoles into 18 comes out to be milligram per deciliter. So this is how we go about, right? And also with the others. So you need to know the conversion of kPa, which is being asked in the ABG questions, right? PO2, PCO2 value. So you need to know. If you don't know the conversion factor, it's okay. It's okay, right? So just remember, as in case of PaCO2, can I have the answer? What is the normal value of PaCO2 in kPa, and what is the normal value of PO2 in kPa? Answers. Normal value of, okay, I'll just let you know, I'll not increase your palpitation in the last moment, right? So for the PaCO2, it is taken as 4.6 to 6 kPa, right? Whereas for the PaO2, it is taken as, yes, 4.5 to 6, yes, or 4.6, yes. Good, 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 good. Dr. Praneet, Dr. Sai. And for PaO2, it is, I guess there is a lag in time. Okay, good. 13.5, 10.5 to 13.5. Very good, very good. Right. So great. So wait a minute, I'll just skip that. Otherwise, the ad will come, and I'm not here to monetize this this particular uh, uh, video or the live chat. I am here to help you out in the last minute, right? So yes. So again, for the ones who are going with the exam, if you're not able to recollect, you are not able to remember when I just asked, so don't worry, you will get that normal reference range in the exam. This is safest if you know by heart and you recollect in your exam also, right? It is the safest. But 99.9%, obviously 0.1%, we can't predict everything, right? We can't predict our life, right? So we can't predict what gonna happen in the future. Maybe they don't write, but till date in all the examination they have given the normal reference ranges of all the investigation being provided, right? But they will not give the calculator for sure. Okay, so this was regarding that question being asked by Dr. Sethu. Dr. Vipul, can we use pencil to underline the question in exam? Yes. So you can use, although on the very first page they say, please do not write or do not uh, mark anything on the question paper, right? So when I gave my exam, both part one and part two, I didn't, right? So I marked the question, whichever I was thinking so I was flagging the question that I'll come back and revise, and then maybe if it requires, or when I was leaving the question, I used to circle. But at the end, I have rubbed all the markings in the question paper. But I have got feedback from many other candidates from my batches itself that they have marked it, and they have, scribbled everything. They have calculated over there. They have not rubbed at the end, but yes, they still managed to crack the examination. So this is based on the feedback from the students in my group itself, right? So it's not mandatory, but to be on a safer side, again, I would say do not write much, or do not scribble much, or do not, do all the markings. Yes, small lines or something like that you can mark, right? How to calculate NNTT? Okay, NNT, actually it is not NTT, it is numbers needed to treat, right? So number needed to treat, although again this is not for the academics. Yes, if you are talking about, then we have to go with 1 divided by ARR, right? So absolute risk reduction. So you have to go with, first of all, you need to find out the risk reduction, and that to absolute, right? So you need to subtract that, get a ARR, and then you divide by 1. So this is how you get number needed to treat, right? So go ahead with all these formulas, right? Odds ratio, NNT, then about your specificity, sensitivity, number needed to treat, positive predictive value, likelihood ratio, right? So these are the formulas which should be on your tips, and do not ask difficult one. The calculation is not difficult one, right? Okay, so I was talking about the things which are required for the actual exam. Is one is the confidence, which I mentioned. Second is your admit card, and third are the IDs, right? And fourth, I would say plus minus are the ones which you can carry along with you, right? As in case the pencil, sharpener, rubber, again 99.9%, every other center, maybe India, maybe outside India, it is being provided. Apart from UK, because UK have the online exam, right? So it is being provided by the exam center. Also, you can carry water along with you, or something to eat, right? As in case of any chocolate or any protein bar. So what I got for my exam, again in 2019, I had all these things in my bag, right? And I took a water bottle, and also a protein bar, which obviously I hadn't had in my examination, because it would have wasted much of time. And I was thinking, if I'm the only one eating in the exam, will I be taken as the weird person or the odd person in the examination? So these are the other things which get onto your mind, right? So although I was having that craving to have that protein bar, but still I didn't go ahead with it. Obviously, I had that in my break after one paper. But you can carry, and some are the center that will allow, but majority of center they don't, right? So don't allow. So as in case of mine, in my part one they allowed, in part two they didn't, and I have the confidence in part two that yes, it's not required, right? And I keep on getting question on my mail, on my WhatsApp, that sir, can we carry glucon D, can we carry 5 star? So it's not about the brand or what you carry. Some other centers they will allow you, right? And if you have some health issues, as in case, obviously I don't predict and I don't see anyone having diabetes and on OHAs or insulin, then yes, you will be allowed, right? In those circumstances. Anyhow, how many questions to revise before the exam. So Dr. Monica, again, so it's not how many questions, it is the papers which I mentioned, around 10 papers. And to be very good, first of all, on the recent examination, right? Maybe the April, then the January, then the December. So these 3 4 papers until the August. So 3 4 papers are very important, and these questions, they carry very high weightage. Why? Not about the questions. Exact question will not be repeated, because these are the recalled ones. These are not the exact ones. When I have made these recall books, it's not the exact but the recalled ones. So you can't expect. You just need to know that these are the topics which are being asked in the examination, which you need to go ahead and revise it then. So please restrict yourself to that. And what I just mentioned around 20 minutes back or so, that go ahead with 10 papers, not more than that. And if you are able to just go with 5 or 6, it's okay. It's okay. Don't have that palpitation that only 2 days are left. And Dr. Chirag mentioned about 10 papers. I'm only able to get through only 5 papers. It's okay. But you need to actually know the topic. Again, I'm re-emphasizing, because that is the important point, that it is the topic, not the question, right? Okay, so I thought in Malaysia also have computer-based exam. Oh, I don't have much idea about Malaysia center, but anyhow, if you have the computer-based, so it doesn't matter much. It doesn't matter much, right? So yes, you will be saved from marking those circles and the bubbles. Dr. Monica says, and is there any distribution of subjects what we have in first half and second half? No, no distribution. They don't have any criteria, right? Anything can come in part 1, anything can come in part 2. The difficulty level can be high in the paper 1, can be high in the paper 2, right? So again, there's no distinction and there's no differentiation. You can, so, and it depends on person to person. After the exam, what I get feedbacks from the candidates from my group who has actually cleared their examination. Some feel that the paper 1 was difficult, some felt that paper 2 was difficult, but ultimately both of them, they cracked the exam, right? So I am telling from my experience and from the feedback which I have got from my students in the group. Okay, so these are the things which you need to carry. And I'll not be wasting much time. It's already 37 or 38 minutes. So I'll be concluding with just 3 things. If you all have any questions, so please, you can put, okay, sir, important topics. Can we start, please? Dr. Shubham, can we start, please? Start, please, what all the important topics. Okay, so so it is a very very big list. Obviously, I can't be talking whole of the topics in just a matter of half an hour or so, which is being left. Although yes, I can continue till night, but I'll not be wasting much of the time of all of you, right, who are going with the exam. So again, don't go with the unit wise. Go with the questions which have been asked previously, and read the topics, right? As in neurology, so there are many topics. You need to know about the stroke, the management of stroke, the ischemic stroke. You need to know RTPA, you need to know altiplase, right? So this is how we need to go ahead. How is the presentation of AC, how the presentation of MCA, right? Obviously you should not go with the mechanism, with the concepts in the last 2 days. Obviously it is not possible. So just see if it has been asked in the recent examination. Yes, you need to know about it, right? And the other rare topics also, right? So it'll take much time for me to enumerate all the topics and all the questions again, rather. So I keep on getting again the same questions, and the reply to them is always the previous year papers, and you get to know those topics, right? Okay, how not to do silly errors in while doing questions. Okay, first of all, Dr. Vipul, silly errors, which we actually call it as, are bound to happen, right? These are human errors. So after giving the examination or after the exam is over, and we feel, what we say as a feedback is, oh, I made 10 questions as a silly errors or silly mistakes in 10. But you forget to tell about the other 10 which you might be having a query, right? Whether to go with this option or not. And you ultimately, it came out to be the correct one, right? So you guessed it and it came out to be correct one, and you feel कि हाँ वो तो मेरे को पता ही था, right? वो तो आता है मुझे, right? So for silly mistake, one thing I would say for those who are going with a pencil and paper exam, please make sure that you are marking the correct option and the correct question of the particular, I mean, which is you are trying to answer, right? So that is the biggest and gross silly mistake anyone could do in the actual exam. And I have got some feedbacks from the students that they try to they try to mark the answers on the OMR sheet in the last few minutes, around 15 minutes before the exam ends and around 20 minutes before the exam ends. So that is a very high pressure in the exam. So my suggestion would be to go ahead marking the particular answer at the very same time when you are reading the question. Right. So this is my advice. Again, it depends person to person. Because at the end, there is a possibility when you are marking only the options, there might be a possibility you can change. I mean, you can have, wait a minute. So there might be, wait a minute. So you there might be a possibility that you might end up bubbling or marking the wrong list, right? So please, that will be a very gross error, and it's not a silly mistake. It would be a gross error, and it is suicidal to do that in the examination. So please refrain from that. If at all you have the habit to mark at the end, you don't want to go ahead with the at the same time reading the question and then marking the answer in your OMR sheet, then I would say please finish your examination by 2 hours, or maybe maximum of 2 hours 15 minutes. That is the max you can. You need to have at least 45 minutes with you for marking, although it just takes 20 minutes. I have tried, right? I have tried marking all the, so seeing the question and then marking, so it takes around 20 minutes or so for 100 questions. But in the end, obviously there can be some possibility invigilator comes and takes your sign, and there is questioning and all those circumstances. You can't predict that. So that is one of my advice, that you can go ahead marking that. Coming back to the question which is being asked, how to decrease the silly mistakes. So some are the silly mistakes which are bound to happen, right? So but to decrease that level, always read the question properly. Some are the questions which you might have done while you are preparing for UG, also for MBBS also, and for the PG examination also, that they ask which is the incorrect one, right? And you directly see the first option or second option seems to be the correct one and you mark it, but they have asked incorrect one. So see that, see any kind of allergies being mentioned, and this is particularly taken care in questions from infectious diseases, right? So if they mention the patient is allergic of penicillin, obviously you should not mark that. So don't just start with the first line and come to the conclusion and marking the option. Don't be that overconfident. That is not over, that is a pseudo confidence. You should not be having. Yes, there is a very thin line between being a confident and a overconfident or pseudo confident, right? So don't be like that. Always read your question properly, and in your part one, they just ask in a 2 or 3 lines maximum. In part two, yes, you have limited time, and the stem of the question is very high, and having 10 questions, 10 liners, 11 liners with a whole list of investigation in part two, but not in part one. So just relax down. It's not in part one. Maximum you will be getting 3 or 4 liners, right? So read the question properly and then mark it. So that is one advice for not making much of silly mistakes. And if let's say you are unaware of a topic, or you are unaware of a particular question, please try to rule out from the options given, right? Don't be just like A, B, C, D, which one is good, right? Going with B or maybe C or D. No, so that is not done. So if you don't have any clue, rule the options out. But again, simultaneously not wasting much time in the actual exam. Restrict yourself and keep a timer. What I prefer is you should be able to complete at least 50 questions in 1 hour, right? If not, max, I mean, the minimum should be 45, right? So 45 questions in 1 hour. So in 2 hours you will be either at 90 or must have completed 100. So just have that time frame, because you can't waste much of time ruling out all the options of all the questions. Obviously you have to respect time, right? So it is you have to have that time frame, right? So this is the answer to that particular question. Also have got a question from Dr. Sai, sir. Do we have limited vacancies for giving the exam in an exam center, as I'm planning for October diet? No. So if you have, so registration will start from 14th of August, right? And till 21. And usually, again, 99% you will get the center and you will get the seat. So this is not in case of paces. So in part one, part two, you will get. So the only thing, if you have paid the amount, पैसा दे दिया है, you will get the seat. Don't worry. ठीक है? In part one and part two I'm talking about. So don't worry. You will get the seat. Just see how much are you prepared, how much are you determined. I'll be talking about in the later 5 minutes. Okay, now further, should we read the question 2 to 3 times to prevent those errors? No, again, the thing is you have to respect time, right? So don't keep on rechecking. That is called as OCD. Don't have that OCD in your mind. Na? Again, keep on checking the question, keep on checking the option, keep on checking whether you have marked it correct. That is a OCD. You have to overcome that OCD wali feeling, right? So as I mentioned, 50 questions in an hour. So cut down to 25 questions in half an hour. Further cut down is around 12 to 13 questions in 15 minutes. So you have to have that. You can't be giving half an hour to just 15 questions. It will be lethal, it will be suicidal, right? So if you are going at a right pace, then yes, you can see the question again, not more than 2 times. No, not done. इतना OCD भी ठीक नहीं है, right? So just believe in yourself that yes, you are marking it, it will be correct. And if at all you have a doubt, just have a small mark over there in front of the question and come back at the last. Don't keep on revising every question 2 or 3 times. No, not advisable. uh, then we have a question: is past medicine question bank done thoroughly enough? Okay. So again, very frequently asked question. First of all, are you going with this August exam or the October exam or the later on, Dr. Shubham? So it is not dependent on any question bank, right? All the question bank are good. Although yes, I would say I love past test more, right? The best one. It has the best questions, no doubt about it. But yes, if you are going with past medicine also, then yes, you will be able to crack the exam. So you have to know the topic, not the question. Again and again, I keep on saying is you need to know the question, not the particular question. Exact question will not be repeated in your actual exam. Yes, there is a slight possibility, only I would say around 20-25% possibility of some questions being repeated from the sample papers which are there on the MRCP website. There is a possibility, but exact question from the question banks, no. Yes, topic would be repeated, right? So that is why I'm emphasizing on the previous year papers. August. Okay, Dr. Shubham. So this you don't have much time thinking about past medicine or past test or on exam, right? Or Intellect Medicos. Nothing. You have to just go ahead. Whatever you have read, whatever you have invested for past 3 months, 4 months, 5 months, you have to revise whatever you have read. Don't change your source at this moment. It will be again suicidal and lethal, and we keep on getting that thought in the mind कि यार पास मेडिसिन कर लिया तो पास टेस्ट में क्या होगा, पास टेस्ट कर रखा है तो पास मेडिसिन में क्या होगा, सारे क्वेश्चन पास टेस्ट से ना आ जाए या सारे क्वेश्चन पास मेडिसिन ना आ जाए, राइट? नो, ऐसा नहीं है, राइट? सो इट इज नॉट द क्वेश्चन बैंक, इट इज योर प्रिपरेशन एक्चुअली. You need to know the topic, not the questions. That is the best thing, and I keep on repeating in all my sessions also, that it's not the questions, it is the topic which you need to be thorough with. uh, Another question from Dr. Monica. I'm not sure whether felt it. Previous year question difficulty is different than the question bank. Yes. So I would like to ask, do you feel previous year question the easier one or the other way around? What is your thought about it? As you mentioned that difficulty is difficult, so in the past test also they have mentioned that if you are able to score, they have given some percentage, pass percentage as 63 or 62 or 64, depending on different papers. So so again, don't go with those percentages. I would say if you are able to, and this is for the advice who are going with the October exam, not this one, right? Because who are going with the August exam, the time is over for analysis and judgment. You can't analyze yourself more. After 2 days, MRCP people will analyze you, right, and will judge you. So don't analyze, don't give whole those 3 hours giving the examination and getting the mark that I have scored 65 or 62 or 61. No, don't go ahead, please. Don't. So my thing would be to go ahead with just uh, wait a minute. It's getting few messages on WhatsApp now. So if whosoever, it's many messages on my WhatsApp now. So please, I'm right now over here. If you are here on chat, so please write it down over here because it'll distract me on the WhatsApp messages. Okay. If you are going with a later examination, so I would say you can follow any question bank, but again, the topic is important. I missed the question which you asked is, yeah, previous question is easier. Okay, yeah, Dr. Monica, I was at your question. So previous year, yes, rightly said, the unit wise questions and past tests are quite tough, no doubt about it. But again, that is helping you to, and that helps you to read more about the topic, right? So, and this is what actual exam is. This exam is not much tough as you compare with USMLE standard, or if you compare even with the questions in your NEET PG nowadays, right? So they are asking difficult questions nowadays in the NEET PG, which I have come across, right? I keep on seeing the questions here and there, USMLE questions, NEET PG questions. So I keep on seeing the question all over. So the thing is, yes, what they want is the superficial level, which is actually important in your clinics. It's not a wasteful thing. They don't keep on asking all the random questions and all the irrelevant things. Yes, few are the topics, like in case of cystic fibrosis, they ask which is the mutation, where is the mutation. You need to know that number also, which is cystic fibrosis, CFTR gene, and the mutation is at the level of, the mutation is called as delta 508, right? For 508. So, so these are few questions. Or if you talk about, F508, yeah, 508, delta F, right? Great, Dr. Shubham. So, so you need to have just few questions about that, but usually the questions which are being asked in MRCP are very relevant if you are practicing as a physician. So you need to enjoy, and this is what I advise to all my students in the group, also in my Intellect Medicos group also, that when you are reading for MRCP, it is very fun to apply that in your clinical knowledge and apply in your clinics. And yes, you will get benefit in your clinics as well. It's not just grabbing the degree. You will get the difference, you will feel the difference, that yes, I able to make a diagnosis, I was able to give a proper treatment, I was able to send a investigation which is being required, right? So as in case of SIDH, right? Let's for example, because this SIDS is also important for the exam, right? So you need to know that yes, these are the investigation you need to send, and these are the investigation which is mandatory. So as to say SIDH is the patient has SIDH, you need to have that cause, you need to have the clinical examination which says euvolemia, you need to send serum sodium, you need to send serum osmolality, you need to send urine spot sodium and the urine osmolality. So these are the samples, and this is what the text is. You need to know. And then after sending all those investigations, you have to rule out all the other options, having the thyroid function, the kidney functions, and all those things, right? So which is in the criteria. And then with what is the pathophysiology, there is more of ADH, so more of retention, although the patient is euvolemic, right? Although the patient is euvolemic, there is more fluid retention because of inappropriate release of ADH. With that, the first thing comes is the fluid restriction. So now the thing is, once you have read it, you will be able to apply in your clinics and you will not jump onto the treatment. I have seen many doctors in my clinical practice also, as a junior doctors, as my colleagues, as my seniors also even, they just say the sodium is on a low side, start a net price or a 12 aptum. No, not done. Not done. If you are following that kind of thing because you have seen your senior doing it, not done. You are not following the guidelines, and guidelines are not just to write in the exam or to follow in the exam. It should, you should apply in your clinics and you will enjoy it. Once you have restricted, still not being managed, now go with tolvaptan or the net price, which you might have read, or the other option is conivaptan, which you can go with a IV infusion. So this is the whole text I just talked about. And for the examination, please remember the causes as well, right? The drug induced, neuro causes, PEEP. So all these you need to remember, right? You need to go ahead. SIADHS. So this is just for example, right? One of the many, one of the many. I can't go ahead with all of it. You might have read also in your previous year papers or the question banks. Okay. So then I guess okay. Should we need to go through first aid for part one? First aid for part one. Are you talking about the USMLE first aid, Dr. Neelam? If I'm not wrong, right? Do let me know if you're talking about that. And if so, you are thinking about that. No, not advisable, not at all, not at all. Obviously, if you have much time, you can read whole of the literature. You can read Harrison, you can read Davidson. Obviously, Harrison would not work in MRCP. What works in MRCP is the Davidson, is the Kumar and Clark, is the Oxford Medicine, and the NICE guidelines. And I usually quote these in my all lectures. So all my lectures contain the text from these four standard books, and these four things. One is Davidson, the other is your Oxford Medicine. Third, very, I love this book, is the Kumar and Clark's. Very good book, very good, very thorough, very good demonstration and examples and everything is perfect in that book, right? More than Oxford Medicine, I would say. Although I have heard from majority of people they like Oxford, but per se, my thing is I like Kumar and Clark's first and then the Davidson. Davidson is also very good. And then you have to follow the NICE guidelines. So you can't, I mean, it's not like it's an absolute contraindication. You can go ahead with all the literature available on the internet, and there might be many more books. But the thing is, you need to restrict and you need to focus, and then only you will be able to score high in a particular exam. Otherwise, you would have given whole of your effort, given 6 months, 1 year, and then still trying to manage in the end, trying to gather all the information which you might have read in the past 4 5 months. So don't keep on going here and there. Don't have that greedy nature, right? Which we all medicos as a doctors have, that to acquire more. But you have to respect the time. If you have only 2 months left, 3 months left, you should not, right? Restrict what is being asked in the examination. If you are planning after a year, yes. Or if you are in third year or final year, yes, you should, right? You need to be good in those basics, then yes, you can go ahead. I guess I have answered your question, Dr. Neelam. Then is just I'll take 10 minutes more. It's already 58 minutes because I can see few other questions from Dr. Shubham and Dr. Monica. Sir, is it advisable to do past papers now in the last 2 days or revise the most important things? Okay, to that particular question, I would say again, is go with at least. So if you have made a list or if you have good notes, right, that this is what you need to revise, yes, you should go ahead, but do not skip the recent examination question. And again, do not read if you have less time. But I suggest, wait a minute, I'll just skip the ads because it'll come and I don't want to waste your time. I have skipped my ad because again, this is not for the monetization. I just want to help you out with all the questions and all the queries. So now the thing is, for your particular question is the previous year papers. You just see, don't read the question anymore. all those who are going with the August exam, right? Just 2 days after this, or you just have 7th and 8th. So I would suggest and I would recommend, just see the answer. If you know it, then read. Do not read the explanation, also skip it. But if you are unaware, right, let's say a question is of Fanconi syndrome, right, or renal tubular acidosis, you're not able to recollect the type 1, type 2, or type 4, you're not able to recollect, then yes, you can go ahead reading the explanation of that particular question, that these are the types of RTA, these are the causes related, this is the presentation of type 1 or type 2 or type 4. What so just go ahead with the explanation of a particular topic. Again, please do not, if you have less time, you think you have to revise much, obviously there is much to revise, do not read the question, see the answer. If you know the explanation, skip, go to the next one. If not, read the explanation, or the explanation from where you have read it. And don't keep on changing your books, because that will waste your time in the last critical time. Okay, so wherever you have read it, just stick to it, revise that only. Do not switch your question bank, do not switch your theory books or your notes कि किसी और से notes मिल गए, right? You get a messages on your WhatsApp, on Facebook, these are the last minute notes, these are the revision notes. So again, do not come across, do not do and fall into that trap and keep on reading new things. Medicine is very vast. Let's say I just give you 100 pages or 50 pages. Do not, because you have to read and revise what you have read in last 2 days. Do not, please, right? So I'm trying to save you from doing a very big mistake. If comfortable, you can take my suggestion that do not go with that. Whatever you have read, wherever you have marked, revise that, because that will give you a guilt after the examination. If you have read a topic, you're not able to recollect, you have marked in your question bank, in your theory book or the PDF, wherever you have read, but you're not able to revise and you are not able to recollect in the actual exam, it'll give you a guilt. And if, let's say, a new question comes, right, having a mutation in, let's say, hemochromatosis, or any weird question, and majority of people have not done it right, you have not done it right, it's okay. But if you have made a mistake, what you have read and which is to be known actually, so that will give you a guilt, and that will actually decrease your score in the exam also, right? So do not make that mistake. Dr. Monica, if a question has severe metabolic acidosis, hyperkalemia, acute kidney injury, hyperventilation issues which to be addressed. So again, what next we do? So it depends on the, so what you have written, all these things is you have to see what is the presentation, right? Patient having acute kidney injury, metabolic acidosis, hyperventilation will cause your respiratory alkalosis. So obviously, if patient have a problem with metabolic acidosis, as in case, whenever you have acidosis in body, it negatively impacts your myocardium, right? So it is very lethal. Whenever metabolic acidosis is there, it is very lethal. You have to address that. But again, it depends on the presentation, how the presentation is, right? So there are many. I mean, you can have many permutation and combination with that question, right? So usually with the so if they also say hyperkalemia and you are, yes, so this is one thing which is very important, is hyperkalemia, very rightly said. So there are again thousands of things. So one thing is hyperkalemia. When they mention there are ECG changes, obviously you have to go ahead with calcium gluconate. And one question which they have asked in, I guess if I'm not wrong, in April exam, yes, April, there is one question I have recalled in my book also, recall book also, that they have given a scenario in which potassium was pretty high. I forgot the value which they have given in the exam. Uh, and in the last line, what they have asked is, how will you get rid of this excess potassium? And the first option was calcium gluconate. So it is there in your mind, hyperkalemia, ECG changes, calcium gluconate. But in the last line, they have asked how to get rid of the excess potassium from the body. This is the almost, I would say, 99% यही एक question था. That they have changed the last line. And then obviously to get rid of the body, you can't go ahead with calcium gluconate. Calcium gluconate is only, it is only causing your cardiac membrane stabilization. That is the only role of calcium gluconate. It doesn't decrease potassium level in your body or doesn't increase the excretion of potassium from the body, right? So then you have other, and the answer to that particular question was actually resins, right? So you go K bind जो normally हम देते हैं, right, in our practice also. So you go with resins. Okay. Then is hyperkalemia and metabolic acidosis. So yes, this is what Dr. Shubham, I talked about, that hyperkalemia, if it is lethal, if you are getting arrhythmias, you have to consider that first. If ECG changes are mentioned, you have to consider that first. If they say patient having a bradycardia and all those things related to your metabolic acidosis, then you go with your soda bicarb if the pH is less than 7.2, because that is the, so to give soda bicarb you have three conditions. One condition is your pH. If pH is less than 7.2, you have to, right? Some books write it as 7.1, some write it as 7.2, but yes, 7.2 is taken. Simultaneously, you have to see the base deficit and the bicarbonate level. If the bicarbonate is less than 15, yes, you should think about it. If the base deficit or the base excess, so if you write BE, that is base excess, which is actually not to be written, because if you say base excess, then it is minus 10. If you say base deficit, then it is 10. So it is the base deficit. So if these are the criteria, then yes, you have to take care of metabolic acidosis. You have to go ahead with sodium bicarbonate, right? But yes, hyperkalemia can be a lethal thing. So hyperkalemia, because it produces all the arrhythmias, and mainly the first change you will see is the tall T tinted T waves. With that, the next thing happens is the PR prolongation, then PR segment depression, and the last, before the cardiac arrest, you can have sine wave, right? So with that sine wave, patient can have cardiac arrest. So this is a lethal thing. You have to address potassium first, then is the metabolic acidosis. But again, there are many permutation combination. You have to see the presentation of the patient. If they say potassium is on a higher side but is not causing any kind of arrhythmias, obviously you have to take care of the metabolic acidosis, right? Let's say they give a figure of 6.2 potassium, right, or 5.8, but the range is they are saying till 5.5, but it is not causing any arrhythmias. Then yes, and pH is quite low, patient is hyperventilating because of metabolic acidosis, the conscious level is going low. You have to take care of metabolic acidosis. So again, what I mentioned is it is upon the scenario, and there can be thousand multiple scenarios. So what they keep on changing or molding is the question. But if you know the theory, if you know the concept, if you know the topic, then yes, you would be able to, right? I hope I have answered your query. What do we do next? What we do? No for MRCP. Kindly let me know. I want to appear in January. So should I focus pastors or something else? So for the ones who are focusing on January, I'll have another YouTube live session, right? I'll not be wasting much time. For the ones who are going with this exam, I'll not be wasting much time. And I'm not promoting my channel or my group or my course, nothing, right? So I'm just here, or monetization from YouTube, nothing. I'm just here to help the people, help the aspirants who are going with 9th August exam, right? So please don't take it wrong, Dr. Osman. So I'll be going ahead with the Instagram live or YouTube live in next month or so, and before the October date also, and before the January, right? Okay. Then is Dr. Okay, sir, how many latest papers should I do? I have already answered, Dr. Shubham. It is the topics you have to see, and I would say just go with 10 papers, 10 previous papers, not 10 years, 10 papers. That would suffice. And if you are able to go with just 4 or 5 papers, but you are going retrospectively with each and every topic, that is also sufficient, right? So you have to manage it with your time. You don't have 10 days or 15 days left. You have just 2 days, right? So don't be in a hurry to cover 10 papers. Ki sir, Dr. Chirag ne bola 10 papers, so 10 papers karne jaise bhi karna hai. Nahi, it's not the question, it is the topic. So if you are able to manage just 3 question papers or 4 question paper, yes, but that should be a thorough one, right? And do not spend much time with one paper. Try to skip questions or the explanation which you have read or which you already know. There's no point reading cystic fibrosis again and again. There's no point reading SIADH again and again. If you know it, you know it, right? So just keep on grabbing things which you don't know and which you are not able to recollect. Okay, calcium, resonium. Yeah, resonium. Yes, Dr. Shubham. Good. So resins are being given. Many thanks. It was a nice session. Thank you so much, Dr. Ankur from the ICU channel. Thank you so much for being here and giving your feedback. Dr. Shubham, thank you so much, sir. Okay, most welcome. My pleasure. Yeah, most welcome, Dr. Dushmantha, Dr. Sai, most welcome. I'm happy to see that, yes, if you have found this discussion helpful, do leave a comment that yes, it was helpful, or so whatever your feedback is. I don't bias or I don't force anyone, right? So if you feel so, you can leave a comment. But although what I want is not the comments, is your selection in the examination, right? So keep on preparing well. And one thing I would like to conclude at the last, which I keep on saying in all my sessions, right? And all students know it. So three things which you need to know and which you need to have still, if you have 2 days left. So three things are very critical, very crucial, right? Most welcome, Dr. Tang. Most welcome, Colorful World. I like your name, Colorful World. Yes, it is a colorful world, and we need to enjoy every aspect of it. Now, the thing is, the three things which I was mentioning is one is your determination and belief. So if you have registered for this exam, obviously you are determined, but simultaneously you need to have that belief in yourself that yes, I can do it, right? Even though you're not able to prepare in a manner which you thought of initially, you were not able to revise initially, which you thought of, right? You're not able to do it. Then also I would say just believe in yourself while entering into the exam hall that yes, I can do it. I have read much. I'll be much better than the other. So self confidence is very utmost important in the actual examination, right? Second, I keep on saying is the hard work, and still you have 2 days left. So please prepare in a manner so as to have efficient revision. You don't go with the new topics, new questions, go with efficient revision. And third, which I keep on saying, is the last thing which is required is the sprinkling of luck. We need that luck on the very last day, on the actual exam day, right? So it's not just the belief or the confidence and the hard work. Yes, majority constitutes that, but simultaneously, so there is most important thing which is said as the luck, right? And whenever you are in doubt with any particular question ki हाँ यार समझ नहीं आ रहा, you don't know much, you have tried ruling it out, right? You have read the question, you have read the option, you have ruled out, and now stick, you have two options left, right? कुछ नहीं करना, just fold your hands, see to the god, pray कि please ये वाले question में please help with the guesswork, right? Or move with the next one, mark it, move with the next one, and please attempt all the 100 question. Do not leave any particular question unmarked, because there is no negative marking. It will be again a suicidal to not mark in the actual exam and going with 95 question or 96 question. You have to mark every question, 100 in paper 1, 100 in paper, so you have to mark all the 200. There should be no question left. If let's say worst case scenario, you don't have much time in the end to read the question, mark B, C, D, whatever you are thinking about, or whatever guesswork or whatever option is coming in front of you. You have to attempt all the 200 questions. Please do not leave any single question unattempted, right? So that is my show, Dr. Chirag, but I asked this question because I already passed it but don't know what to do. Okay, so so you can just drop a mail on my mail ID, which I mentioned earlier also. I'll just write it down: intellect.medicos1 at gmail.com, right? So this is my mail ID. You can thank you for your valuable time, sir. Okay, most welcome, Dr. Neelam. And I guess Dr. Neelam, youth from Nepal, if I'm not wrong. I got a message around 6 months or maybe 7 months. So with the same name, Neelam Thusa, if I'm not wrong. Because कभी कभी नाम याद रह जाते हैं, right? So if I'm not wrong, youth from Nepal, right? Okay, anyhow, so I'll conclude this, and I'll wish you all the very best for the ones who are going with this examination. Be confident, and yes, you will do good in the exam, right? So don't be underconfident, don't be thinking too much about the other resources that I would have done this course, I would have done this question bank, I would have followed this book or these guidelines. No, not done. This is not the time to think about it. Just have that confidence with you, move into the theater, and yes, you will do wonders in the exam, right? So you will do good in the exam. Best wishes and do good in your exam. Okay, bye bye. Take care. Best wishes again.